Welcome to the next episode of HumanX Medical Case Studies. I'm Caroline, and in this video, I'm going to show you how we helped a patient and his surgeon to better understand a specific pathological situation prior to an endovascular intervention. The CT scan for the case was provided by a Vascular Center 2 weeks prior to the planned intervention. Based on the CT images, the aneurysm can be classified as an infrarenal aortic aneurysm. It's the most common type of abdominal aortic aneurysm, accounting for about 60% of all cases. An infrarenal aortic aneurysm is a bulge or dilation in the abdominal aorta that occurs below the kidneys. Aneurysms are caused by a weakening of the aortic wall, which can be due to a loss of smooth muscle cells or inflammatory processes. Risk factors include smoking, age, being male, family history, and other aneurysms. The surgeon intends to use a procedure called Endovascular Aortic Aneurysm Repair, or EVAR. It is a minimally invasive procedure that uses only small incisions in the groin to access the vascular system. He then uses a catheter to place a stent graft inside the aneurysm. The stent graft acts as a new pipe to reline the aneurysm and prevent it from rupturing. In order to choose the right size of stent graft, it is very important to determine some key dimensions of the aneurysm. In this case, these are the diameter of the aneurysm, the neck length, the diameter of the aorta, and the diameter of the common iliac artery. In this case, the model designed and produced by HumanX should fulfill the following purposes. Represent the pathological situation in great detail. Allow the surgeon to practice the procedure. Help explain the situation and the procedure to the patient. Keep the case for later training with younger physicians and residents. One particular focus was the presentation of the right common iliac artery. This had a special shape that could influence the guidance of the catheter. We decided to design a two-part vascular model. The aortic aneurysm should be made of transparent acrylic material to allow a clear view into the vessel. The bony structures were to serve both as anatomical landmarks and as a secure stand for the acrylic model. Our HumanX score for 3D modeling and printing shows that the model is easy to print. The bony and vascular structures are clearly visible on the CT, and the segmentation does not pose any major challenges. Due to the size of the model, a longer printing time is to be expected. We again used 3D slicer to segment all relevant structures from the provided CT scan. After a first orientation using the volume rendering tool, the volume was cropped to the region of interest. As you can see from the CT images, the gray values of the aneurysm and the surrounding organs and vessels are very similar. Bones and contrasted areas of the aorta are clearly visible, but also have a similar gray value. This makes automatic detection of the relevant structures very difficult. There is a great risk of detecting areas that do not belong to the aneurysm. For this reason, we marked the structures layer by layer manually. Even though the segmentation takes longer this way than using an AI-based tool, the result is more accurate and reliable. This also minimizes the time needed for post-processing and adjustments. By using the coronal and sagittal views of the CT scan, we try to capture as much detail as possible. This iterative method is important to ensure that only relevant areas are highlighted. The segmentation of the aneurysm and the associated vascular structures took around 40 minutes. In a second step, the same procedure was used to extract the spine and hip bones. In this particular case, the level of detail of the bony structures is not as important as in models with an orthopedic background. Vertebrae, sacrum, and hip bones can be segmented as one unit, as they will only serve as a reference and support for the aneurysm model. The final rendering of the segmentation shows some defects that have to be removed before sending the data to the 3D printer. The aneurysm is, at this stage, still a solid body, and has to be converted into a hollow vascular model for later use as an endovascular training tool. Using Mesh Mixer for the 3D post-modeling, we removed all defects and inconsistencies. Remaining gaps and holes are filled to get a closed, vessel-like surface. When working on the digital model, it is important to be very careful not to change the size of the model or remove relevant structures. Remember that the final product must be a detailed replica of the patient's anatomy. In an endovascular procedure, the inner lumen of the vascular structure is used to guide the catheter to the aneurysm. Therefore, the model must represent a hollow vessel. The segmentation only provided us with the lumen as a solid object, which is now to be transformed into a hollow object by adding an additional shell. To fulfill the requirements for a durable and long-lasting training model, we added the additional shell with a distance of about 1.5 millimeters. The bony structures of the spine and hip bones are also post-modeled with mesh mixer. This part was added to the vascular model as a simple solution for orientation and fixation. Therefore, the level of detail could be lower than in the main model of the aneurysm. The final 3D model features a very detailed replica of the pathological situation of the patient's aorta. The post-modeling process took about 50 minutes. To print the bony part of the model, we used common FDM technology. This part of the model represents rigid bone structures, and there are no special mechanical or medical requirements to the material. The material we have chosen is PLA, but it's also possible to use ABS or PETG. The total print time for this part was 8.5 hours. Following the requirements of a transparent model of the aortic aneurysm, we used a technology called digital light processing or DLP. DLP 3D printing is a resin 3D printing technique that uses a projected light source to cure liquid resin into solid plastic objects. These printers are capable of producing highly detailed parts with smooth surfaces and exceptional accuracy. This is very crucial for transparent models. In this case, the model of the aorta was printed in about 11 hours. After printing, the support structures had to be removed from the model. Finally, the model was cleaned with isopropyl alcohol to remove any resin residue. The final model has a high level of transparency, which would not have been possible with an FDM 3D printer. Assembling the model of the aortic aneurysm is very simple. The transparent model of the vessel is placed on the bony structures. The shape determines the correct placement in relation to the spine and pelvis. To avoid unintended displacement during use, the vessel model can be secured to the base with a rubber band. Besides the common use as a dry model, it also can be submerged in a container filled with water or connected to a pump. This enables some additional advantages. First, the level of transparency is being highly improved. Second, the fluid works as a lubricant for the guide wire and catheter, especially when using tools with a hydrophilic coating. Finally, when using warm water with a temperature equivalent to the human body, the use of self-expanding stent grafts will be enabled. Due to these benefits, we recommend the wet use of vascular models. The total time required to create the model was around 14 hours. After the model was delivered to the hospital, the medical team was able to test and train the desired procedure. Together with the manufacturer of the stent graft, they were able to validate the result of the procedure and the changes in blood flow in the aorta after insertion of the stent graft. Finally, they found a solution for the unique pathology of the right common iliac artery. This reduced the risk of rupture of the vessel during the procedure and shortened the time in the operating room by 25%. This brings me to the end of today's case study. If you would like to download the model, please follow the link in the description below. If you liked this video, please subscribe. This will ensure that you receive a notification when we upload the next HumanX medical case study. If you have a case you would like to share with us, please feel free to contact us or write it in the comments.